For the stretch injury to the nerve, if you get it early, oral steroids can knock it out pretty quickly because it's inflammation is the problem. If you don't get it early, that inflammation leads to scar tissue deposit and the nerve becomes trapped in the ligament so that movement's aggravated. That may take injections of steroids. And if the injected steroids don't work, it's not the end of the world. You can do surgery to release that nerve. In my experience, I've gotten elite athletes back to full competition releasing that nerve so that they don't get headaches every time they try to exert themselves, get hit, or head soccer balls. Let me give you one other point. When that neck that's supposed to be immobile is rocking, you're going to have a tremendous sense of dizziness and imbalance. And it's never going to get better, even through physical therapy, until you immobilize that joint again the way it's supposed to be anatomically. The other thing is this intense pain coming in from this occipital nerve can block balance information getting into the nervous system from the muscles and ligament stretch receptors. So our experience in clinic is we were doing balance tests before and after we numbed up the nerve, and 20 minutes after the nerves would go numb, balance in the athletes tremendously improves. So if you have imbalance and you're going to physical therapy and you don't address the real reason you have the imbalance, the therapy is going to be ineffective. You have to get that signal into the brain for the brain to reset itself to get your balance again. And if that signal is being blocked down by this painful input at the spinal cord level, you're never going to get better. So not only are these conditions easily treatable, but it's a must treat if you're going to recover and start to function again as an athlete.